In the House of Representatives, Republicans are pledging to investigate charges a study by the National Institutes of Health is being withheld. The study reportedly shows transgender treatments have no mental health benefits for minors. This as new information shows hospitals are making big money off childhood transgender procedures. CBN's Lori Johnson reports.
New financial data shows transgender procedures on minors is both widespread and lucrative.
So absolutely, I think that the motive to simply make money is very much a driving force here.
Since 2019, doctors and hospitals have taken in some $120 million through prescribed puberty blockers and cross-sex hormones, plus surgically removed gender-specific body parts on 14,000 children. The real numbers are likely higher since patients paying out of pocket and some major healthcare centers don't report this information.
Let's face the facts. If morals and medical ethics are no object to you as a clinician, then the trans industry really offers a pretty great business model.
From a profit perspective, transgender minors are seen as a gift that keeps on giving.
They come back for prescriptions across their lifetime. It can't be done in just one visit.
This current trajectory has the childhood transgender industry raking in billions. Meanwhile, a study showing no improvement to kids' mental health after taking puberty blockers has reportedly been hidden from the public for many years. The New York Times reports the researcher, Dr. Johanna Olson-Kennedy, who runs the country's largest youth gender clinic in Los Angeles, still hasn't published her taxpayer-funded study from 9 years ago. "I do not want our work to be weaponized," she admitted, pointing to the possibility of her study being used to convince more states to ban youth transgender procedures, adding to the 24 that have already done so.
What is happening to these kids is not medicine.
Dr. Eitan Haim, an outspoken critic of child transgender procedures, says too many doctors perform them even though there's no evidence they work.
These doctors believe they can become gods and create something new. It's not a doctor's job to harm people, even if the person wants it.
Likewise, regretful patients like Chloe Cole, who had her breasts removed at age 15 while trying to become a boy, are also sounding the alarm.
We need to stop telling 12-year-olds that they were born wrong, that they are right to reject their own bodies and feel uncomfortable with their own skin. My childhood was ruined, along with thousands of detransitioners that I know through our networks. This needs to stop.
So while youth transgender procedures remain widespread and lucrative, the lack of evidence they work, combined with some doctor and patient warnings, could lead to more states banning the practice. Lori Johnson, CBN News.
The study needs to be seen. Gordon?
Absolutely, it should be released, and I don't understand a fear that it will be weaponized. It's not a weapon to say we want to care for children, and if this doesn't lead to better outcomes, shouldn't that be fully and fairly debated in an open democracy? If you've got on one side a profit motive, and clearly there is, on one side, it still rings in my ears from Vanderbilt University that if you're not on board with this, that we're going to fire you. I mean, that you're weaponizing it on the profit side of things. Well, why can't people stand up and say, well, when you look at the results, it's not working. And so if it's not working, why in the world are we doing it? And why are we doing it in a stage of life where you're uncertain who you are? Why make things this difficult for what will soon be an adult who is able to make their own decisions about their own bodies? It makes no sense to me to be continuing to do this without releasing this kind of evidence, because clearly it's evidence it's not working.